My name is Dave Mulder. My day job is as a thoracic surgeon at the Montreal General Hospital and McGill University. My avocation or my hobby has been looking after elite athletes with the Montreal Canadiens, the Montreal Alouettes, and many McGill teams. I'm on the line with David Stein.
Hi, I'm Matthew Darge. Before I played for the Montreal Canadiens, I played for the McGill Redmen. You're watching David Stein, the best sports reporter at McGill University.
Dr. Mulder, as you know, the words concussion and sport have been pretty much interchangeable in the last, few years, a couple of decades even. Why, in your opinion, has there been so many concussions in recent years?
Well, it's the elephant in the room, clearly. And I think perhaps the reason there's so many concussions is that we document them better, we have better assessment of them. And then I think the other relates to the game, particularly hockey and football. Players are bigger. The NHL are probably 10 kilos heavier over the last 20 years. Game is faster, there's no red line, it's a collision sport played at a high rate of speed on an ice surface.
How come concussions weren't such a problem in hockey, let's say 30, 40 years ago when, my parents' generation was watching the game?
Well, that's a good question, and I don't have a good answer. I think one of them is perhaps the current protective equipment renders the player more prone to severe head hits because they've got more courage with the equipment that they're wearing. And I think the other big thing that most players tell me about today is that perhaps the respect for each other is changed or is diminished.
It seems as though different players respond differently to certain things, concussion-wise. You have a guy like Sidney Crosby who missed close to a year with a concussion, and then you have some players who receive what looks like a humongous hit, let's say open ice hit, and they could be playing the next week or the next night. Why do different people respond differently to these type of hits?
And again, I don't think we have a good answer, but we in the medical profession now, we talk about modifiers of concussion. We know that a concussion is different in a female, it's different in a young athlete, and of course it's different from virtually every instance depending on the mechanism and the severity. So it's a broad, it's a clinical spectrum, and it's like injury and anything else. It depends on severity. There's now some evidence from Toronto that perhaps there's a genetic influence. Perhaps there are some people who are more susceptible to concussions.
I wanted to ask you about fighting in hockey. In your opinion, does it still serve a place in our game?
Well, I'm totally opposed to fighting in hockey. I think it's unnecessary.
I read up on you, of course, before coming here, and it's been since 1963, according to the information I was given, that you've been associated with the Montreal Canadiens. Is that correct?
That's correct.
During your time at the Montreal Canadiens, what has been the scariest injury that you've witnessed?
By far the most scary was Trent McCleary, and you recall that he received a puck slap shot directly to the larynx, to the voice box, and it fractured it, and he suffered an immediate loss of the airway. That was my worst.
As is well documented, Andrei Markov had those two major knee surgeries within the span of, I think, less than a year, 2010 and 11. How has he been able to come back and recover from these two injuries and come back and be such a dominant force on the ice?
Well, I think that's a good question. He had an anterior cruciate ligament repair, and I think the answer to your question is his dedication to rehab and to workout. He has worked on a program with Scott Livingston and the training staff of the Montreal Canadiens, and has built his quadriceps muscles, the muscles that stabilize the knee joint, to an extreme degree. And he's a fitness, he works very hard on his fitness. And I think that's the answer.
I wanted to ask you about the Canadiens weekly show 24CH. You might remember that in the first episode of last season, you were caught by Coach Michel Therrien stepping
Right.
on the Habs logo in the locker room.
And subject to a fine.
How much was that fine?
Fortunately, I didn't have to pay it. It was more I think, a joke, and he wanted to reinforce the concept of not stepping on the logo for several reasons. But it was a fun, it was a gesture.
Was that always the case? Or was there a time when it was acceptable to step?
No, that's always been the case.
Okay.
Yeah.
So it was just a mistake by you?
No, I didn't even think of it. I was more concentrating on what I was saying to the players, and I wanted to be in the center of the room. So and I didn't realize that I had walked on the logo.
Another serious injury that's happened in recent years was the hit on Max Pacioretty by Zdeno Chara. Can you just talk a little bit about his recovery and his dedication to coming back and becoming, the player he is today? Obviously, he's got 21 goals so far this season, and I mean, most would argue he's our best offensive player. How has he come back from that?
Yeah, no, I think as you pointed out earlier, there's a difference in recovery rate, and Max Pacioretty came back very fast. He had one of the most serious head and neck injuries that I've seen. It involved a fracture of the skull, of the facial bones, and also of the cervical spine. So he had a very significant concussion. He had treatment for his spine. He was placed in a mobilizing or demobilizing device, and then he basically had rest, and he really recovered over a matter of 6 to 8 weeks. He's recovered fully. In the NHL, we do neuropsych testing to assess their because we do a baseline, so we assess their return to that level. And he returned, and as you note, he has played extremely well. And I guess what we were talking about earlier is I'm very grateful that Max has recognized the need to be more active in concussion treatment. And he has set up the Max Pacioretty Foundation here at the General, where we now are going to obtain an MRI, called a functional MRI, where it's a research machine. There will only be 4 in the world. Ours will be in conjunction with the Mass General in Boston. And we hope it'll provide us the ability to give a more accurate diagnosis of concussion, perhaps lead to new methods of treating concussion, and certainly maybe be a better judge of when we can return players to the ice or to play.
That's great. It kind of brings me back memories, or reminds me of the CT scan that Saku Koivu
Yes.
brought to the city.
It's to me, it's heartwarming, the fact that players on the team have this responsibility or feeling about the community. Saku's getting us a PET scan was revolutionary. The same will be for Max Pacioretty. It'll help all of the players. It'll help not only the hockey players, but the amateur hockey players, but also people who get hurt in a car accident or trauma, which is our hospital's major interest.
You gave a very detailed answer about Max Pacioretty's road to recovery. Far more detailed than Dr. Mark Recchi.
Yes.
Should we call him Doctor?
Yes.
What was your take on his comments that a player who has a concussion cannot be in a movie theater, and that story that
Well, I think that just reflects our general knowledge and treatment plan for concussion. We don't have any treatment for concussion except rest. Now, rest is supposed to include no video or no audio stimuli. It's supposed to include physical rest, mental rest, no TV, no computers, no cell phones. So that's all part of rest, and I guess that's what Mark was talking about.
Final question. Your coworker, Dr. Lacroix.
Yes.
I was wondering if you could talk a little bit about him and your relationship working with him, and what he's done so far with the Canadiens and his role.
Well, Vincent Lacroix and I go back a long way. He started to help me out with the Alouettes and did original work with the Canadiens, and now has taken over the sort of day-to-day care of the Canadiens and is doing an excellent job. My role is sort of as I'm fading out is it relates to my experience as a trauma surgeon, and the NHL demands that we have 2 trauma surgeons at every game. So myself and one of our trauma colleagues are there, and we work closely with Dr. Lacroix. Our function is to look after both the team and the visiting team. So usually I'm assigned to look after the visiting team and to provide the trauma backup in case there was a life-threatening injury. We would help facilitate access to the trauma unit here.
I lied. Final question. Best memory best memory for you working with the Montreal Canadiens?
The night that Saku Koivu returned to play. Maybe the most emotional night I've ever experienced because the people were critical that he shouldn't return, that exercise was bad for cancer, and a lot of conflict. And we'd gone through an enormous treatment protocol and recovery protocol. And I think before the game, he came to me just to thank me. And that was emotional. But then when he skated out on the ice and had a long standing ovation, I looked around the people who were around me, and I don't think anybody, there wasn't anybody who wasn't tearful. And so that was clearly my most emotional moment.
I just want to thank you so much for doing this.
No,
it's been a real pleasure to talk to you, and
Good.
A lot of insight, as I expected to get from you. And
Good.
I can't thank you enough.
Well, if I can help you, but I guess I better go to work.
Yeah, absolutely. Thanks so much.
Thank you so much.
Okay, good.
It's been a
Good.
pleasure.